Hi everyone, we're looking forward to seeing you in just a few short weeks at the 2019 Advocacy Summit here in Washington, D.C. This presentation is going to walk through some of our core legislative asks for your visit to D.C. and what we're really looking for our members of Congress to do on our behalf and the entire arthritis community. So those two legislative asks that we will be looking to share with our members of Congress and their staff here in D.C. in just a couple of weeks are twofold. The first is around ensuring patient-centered reforms to step therapy requirements, and the second is around strengthening the Congressional Arthritis Caucus. Let's take a look at the first legislative ask around step therapy. So step therapy is defined as a practice used by insurers that requires people with arthritis and other diseases to try lower cost medications first before permitting more expensive treatments despite a physician's recommendations. Requiring patients to cycle through one or more quote-unquote steps may take substantial time and impede access to the right treatment at the right time as determined by that patient's healthcare provider, and as a result, a patient's condition could worsen. As an example, let's say a patient visits their healthcare provider because they aren't feeling well. After discussing with the patient and reviewing the patient's medical history, the provider prescribes a biologic medication. The provider then sends the prescription to the pharmacy, and when the patient goes to pick up their medication, they find out that the health insurance company won't cover all of the treatment. The reason being that the patient must try a lower cost alternative first to see if it helps. So this can have an effect on the patient's healthcare, and their condition could worsen since they aren't able to access their medication that the doctor prescribed in a timely manner. And so what happens is that patients need to step through or step up from those lower cost treatments first in order to actually get the medication their doctor originally prescribed. Building on that last slide, we now need to think about how we can protect patients from burdensome step therapy requirements. So there are three key things to remember on this slide. The first is that step therapy processes should be transparent. Processes should be easily accessible on a health plan's website, including contact information and forms, so a provider can easily access the right information and move the process along. Second, providers should be able to override a step therapy decision in certain situations, such as if the treatment a patient needs to, quote, step through would be ineffective or harmful to them, if the treatment would negatively interact with another medication the patient is taking, or third, and most important, if the patient is already stable on the medication, they shouldn't have to go through a step therapy process in order to keep stable on their drug. And third is that health plans should follow a clear and timely review of step therapy override requests. A health plan, for example, should take no more than 3 days to consider a physician's request for an exception to a step therapy requirement, and in life-threatening situations, health plans should take no more than 24 hours. Those three principles I mentioned on the prior slide have translated into a number of state legislative wins over the last few years. The states in green on this slide are those that have enacted step therapy legislation to date, and you'll be able to have a map of these later on, so no need to memorize it now. But there's about 20 states that have already passed step therapy legislation to protect patients within their borders. The states that are in that yellow color are those with active legislation this year in 2019, and states in gray have not taken any action yet on step therapy reform. A question that might be on your mind is why are we coming to the Advocacy Summit this year to talk about step therapy if 20 or so states have already taken action? Well, that's a great question, and there's some key differences. So step therapy at the federal level and the state level addresses different types of health insurance plans. So as you can see on this slide, federally regulated plans are those that are offered by large employers, the Medicare program, as well as federally regulated state health insurance exchanges, those that you can access through healthcare.gov. In the state, there's two different kinds of plans. There's state exchanges, so those states that manage their own individual market health plans, and then the Medicaid program. These distinctions are important to remember when you're having conversations with a staffer or a legislator during our Advocacy Summit, because the federal bill deals with federally regulated plans only. And so keeping in the back of your mind as you're preparing for your meetings, whether your state has passed step therapy legislation can be an important data point to mention during your meetings. Thinking about the prior slide, we can see that we're looking to expand the reach of step therapy reform at the federal level. That's why all of you are coming to Washington, D.C. in just a couple of weeks. The legislation that would deal with step therapy at the federal level is called the Restoring the Patient's Voice Act. In the last Congress, this bill was numbered H.R. 2077, and both original sponsors of the bill, Representative Brad Wenstrup, a Republican of Ohio, and Representative Raul Ruiz, a Democrat of California, have experienced step therapy requirements when they were practicing medicine before joining Congress. While the bill did not have a Senate companion in the last Congress, it did have 88 co-sponsors in the House, which is a significant achievement for just a couple short years. Turning to the right side of this slide, let's think about what the federal reforms to step therapy will be under this legislation. Well, the first thing is that the bill calls for a clear and transparent process to seek exceptions to step therapy review by health insurance plans. So think back to a couple of slides ago where we had that first principle around transparency. That's included in this bill. Second, the bill wants to establish a reasonable and clear time frame for override decisions. Again, thinking to that slide just a couple of minutes ago, allowing providers to override a decision by a health plan in cases where they've been able to understand the patient's medical history and their individual needs is critical. And the third thing that the federal legislation does is requires insurers to consider the patient's medical history and the provider's expertise in partnership with their own patient. So again, this bill requires employer-sponsored plans to establish a clear and convenient process to allow physicians to request an exception. So providing this in a timely way is critical for patients who need to be stable on medication. That's it for our brief look at step therapy as our primary legislative ask. Our second ask is around strengthening the Arthritis Caucus. So as you know, greater education and awareness is critical to breaking down barriers for people with arthritis. And at the beginning of every new Congress, we always need to start thinking about rebuilding the Congressional Arthritis Caucus. So at the start of this year, we had 129 members of the caucus from both the House and the Senate returning to their seats, either getting reelected or continuing on in the Senate. So what we want to do is build a strong Congressional Arthritis Caucus again to help highlight 1, the scope of arthritis and other rheumatic diseases, 2, the current shortage of rheumatologists and pediatric rheumatologists, and 3, the importance of biomedical research to unlock new treatments and cures. With that, those are our two key legislative asks for the summit this year. And we wanted to pause for a moment. And for those of you that are not going to be able to join us in DC this year, we did want to share how you can amplify your action by joining us at our virtual Advocacy Summit. So the virtual Advocacy Summit will provide people who are not able to make it an easy and effective way to share your arthritis story and ask Congress for support without actually being here. The virtual summit consists of two different components. So as you can see on this slide, the first is encouraging your friends to take action to reform step therapy online through our Action Center. And as you can see here, reading more about the issue, taking action, composing a message, and sending it to your member of Congress. And the second is, of course, around strengthening the Congressional Arthritis Caucus and doing the very same thing. We have these short links available here on the slide that you can share with friends and family and others to amplify your message and engagement for those that are here in DC and for those of you that are attending virtually to do the same. So those links are bit.ly/steptherapyreform 2019 and bit.ly/Arthritis Caucus 2019. Stay tuned for more information as we get closer to the summit. So we covered a lot of information in just a short period of time. So what information is available online that can help you better prepare? Well, there are two kind of key resources that are available. Rather, I should say three. The first is our Welcome to Congress packet, which is something that we put out every couple of years when a new Congress takes their seats, and is really a soup to nuts kind of review of our key issues, a spotlight on step therapy this year, which is unique for the summit this year, provides some key statistics on prevalence data within each state, and provides resources such as the Congressional Arthritis Caucus and other ways that a member or a legislator or a staffer can reach out to the foundation and share more resources about the work that we do. The second resource that's available is a listing of the co-sponsors of the Restoring the Patient's Voice Act from the 115th Congress. So as I mentioned just a couple of slides ago, there were 88 co-sponsors in 2017 and 2018. That list is going to be a really great resource for you. So when you come to DC, you can already know if your member was a sponsor previously, and you can encourage them to join the bill once again. The third and final resource is that list of Congressional Arthritis Caucus members that can be found in the Welcome to Congress packet, as well as on our advocacy website. But all three of these resources will be available at the following link below on the slide, arthritis.org/advocacy summit.